Hi guys, how are you? Well, today I'm bringing here for you a video of some tip about the bonding and positioning about the tubes on second molars. I know that uh, a lot of colleagues doesn't like to work with tube and second molars because they are afraid that maybe could occur some kind of open bite due to the fact that they can extrude the second molar and generate this kind of malocclusion. So the video here goes to try to help you on those kinds of things, how to position, how can retract and have a good visualization about the second molars. First of all, I was talking on earlier video about the use of second molars in biomechanics and orthodontics. I want to just bring to you just two examples that I really like to use. Second molars have a lot of other factors that why I like to use second molars in my treatments. But one of them it's on the use of the intermaxillary elastics. Once we use the second molars and we get the elastics through the second molar, like the class 2 intermaxillary elastics, normally the positioning of the elastics can be a little bit more horizontal, and this can reduce the effect of the resultant of the vertical forces that always been generated in the use of intermaxillary elastics, such as class 3 or class 2. And the other example that I really love to use second molars is on the deep bites that we have a very accentuated curvus P. Normally, this accentuation goes on the first molar on the lower arch and the second and the first premolars. And normally the second molar gets a little bit more higher on the same level on the right occlusal plane. And if we use, since the beginning of the treatment, the second molar, this curvus P will be self-correct itself due to the fact that we are going to align and leveling by the using of the second molar. So those are two simple examples of why I really love to use second molars in my orthodontic therapy. So a few considerations before we start here. One of the things that we have to understand is that this second molar has an atypical position regarding all the other teeth that we have in our mouth. You see that the crown is tipped to the distal angulated, and the root are mesial angulated. And this is an atypical movement or a typical position that is characteristic and natural of the second molar. And if we try to correct this kind of tipping, normally what happens is that due to the fact that we are correcting this natural position, will be generated the so afraid open bite. So this is the example that I give to you. If we try to position the tube on this way, like this, obeying like this the occlusal plane of the second molar, what is going to happen is that the wire is going to go through the first molar, through the second molar with a little bit of deflection, and by this little deflection, it's going to happen is that this cusp here will extrude due to the fact that we are going to correct this distal angulation, and this cusp will get a premature contact with the lower second molar, and this will generate our open bite. So in order that we not generate this correction of the tipping of the natural tipping of the second molar, what we have to do is to position or bond the tube just like this. See that I just put the tube on the way that on the same level of the first molar, and you imagine that the wire is going to pass through this first molar to the second molar in a passive way without generating any correction of this tipping or any extrusion of the second molar. So this is the way that I suggest you of how we can position the tube without getting any afraid of opening the bite of the patient. And to do this kind of thing, I will suggest you two accessories. One of them is this retractor, the Minnesota retractor that you normally are used to see in surgeries, and this clamp, which is a curved clamp to bond tubes. With these two accessories, in a simple way, you will basically do your positioning of tube without any problems in a simple and easy way. I will bring you here right now a video of how I do this kind of positioning in my clinic, and you will get know a little bit better. So this is how I work. with this retractor that you are seeing here, I can just retract all the soft tissue of the patient and have a good visualization of the second molar. And with the clamp, the curved clamp, we can enter through anterior to posterior and position the tube without any problem. And by doing that, we can adjust the positioning, the right position that I just suggest to you here of the second molar. Just what you're seeing here, it's a simple way by using two simple accessories, the clamp and the retractor, to do this kind of positioning of second molars. So by saying that, I know that a lot of protocols or prescriptions have their own reference of how to use second molars. This is the way that I'm using in 100% of my cases, because with this kind of suggestion of the positioning of the second molars, of the two and second molars, we don't take any risk to generate any open bites in our patients. I hope you like this video. If you want to share with other colleagues, it will be my pleasure. And if you want to subscribe and like this video, I'm really happy, and I congratulate you for that. And basically, I will bring you more videos through this channel, and I hope you like. And I hope from now on you can use the second molars without any problem and any freight. Okay. Thank you so much for all, and see you soon. Bye bye.